Well, good evening. This study is about evolution and prediction about cardiovascular risk in the type 2 diabetic patients by evaluating analytes as glycosylated hemoglobin and cardiac troponin. The next, please. Okay. So the objective and of this study is to show the prognosis of cardiovascular risk in these patients who has type 2 diabetes mellitus, analyzing the percent of glycosylated hemoglobin and cardiac troponin. This is analytes that is important to measure about chronically, because the patients, maybe we detect the patients when the cardiovascular rate is high. So the analytes, it's normal values are percent of glycosylated hemoglobin less 5.7% and cardiac troponin less 14 nanograms per liter. And measured of cardiovascular risk, 0 to 1, closer to 1, better prognosis. Near 0 is low is the risk cardiovascular. So when we study these analytes in time, or about through the time in these patients, we can see that the percent of glycosylated hemoglobin and cardiac troponin values are increased respect to not diabetic patients as control. That the cardiovascular rate is always high respect to control patients. So when we analyze linear correlation, our result is that with cardiac troponin correlation is positive significantly respect to glycosylated hemoglobin and glycemia. We know that in this type of patients, when this analyte glycemia is high in persistent form, is the high risk to this patient to take in the future cardiovascular disease. And when we have the option to measure glycosylated hemoglobin about 3 months ago, it's important to detect also about glycemia and glycosylated hemoglobin, the cardiovascular disease in the future. When we analyze logic regression of residual cardiovascular risk in diabetics compared to controls, is significantly, and the result is that diabetic patients have 2.5 tries to take a high cardiovascular risk respect to control patients. So that is interesting to show that artificial network is used to take the prognosis about the cardiovascular risk in year, in month, and this result show that respect to hemoglobin glycosylated, we take some measure today. What is the prognosis in the future? June, July, August 25. If we take this the result before 2024, the prognosis in the future is high, and the control is high, but is less to the diabetes patients. Respect to cardiac troponin, is interesting to see that in the future, to take some values in July 2024, and the network by artificial intelligence showed that in December 2025, this troponin is increased respect to control patients. So the sensibility about the proof, the test that about glycosylated hemoglobin is about 75% of the sensibility of the test. So when we compare it, some rock curve diabetes, the sensitivity respect to high glycosylated hemoglobin, the cutoff to take account in these patients, 80% of the value of this patient have a sensibility about 60%. So when we take this patient, the cutoff about the risk of cardiovascular risk is 70.8% of the value of glycosylated hemoglobin. Respect to control patients, the sensibility is more high, about 80%, and the cutoff of this analyte is 5.3% of glycosylated hemoglobin. And this sensibility of the test respect to analyze cardiac troponin is 100%. So the cutoff and this respect to sensibility about the test in cardiac troponin is 85% of this sensibility respect to cutoff when we analyze this analyte. Respect to controls, the sensibility is down about 16% respect to cutoff of this analyte. So it's interesting to show this when in the coronary unit we have a problem with patients with diabetics, because some biomarkers, cardiovascular biomarkers, respect to treatment with metformin, glibenclamide, and glycipide, the values of these biomarkers is down respect to control. when analyze this situation in the coronary unit, we resolve that this patient, diabetic patient, when we are treated with this medicament, this pharmacology, we have to be careful with the biomarkers or cardiovascular biomarkers, because he down respect to control patient, no diabetic. It's important to see to interpretation the values to take the decision when is acute syndrome, coronary acute syndrome. The conclusion: the cardiovascular risk in diabetic people increase almost double compared to those who do not suffer from this disease. Biochemical markers such as percent of glycosylated hemoglobin chronically and early cardiac troponin can help evaluate the cardiovascular risk index. The difference between them is that cardiac troponin levels in diabetic people decrease in the first hours of the pain compared to non-diabetic when they are treated with certain medication, as we see in the slide, and to the disease itself. Okay, thank you very much to hear to me and the project.